I spend 12-hour shifts saving lives in the ICU, then come home and ignore my own chest pain because I can't afford the hospital bill. The irony of being a nurse who can't afford healthcare is literally killing me slowly. My patients get the best care money can buy, while I use expired medications from sample cabinets. I tell myself it's still good, but really I'm just too broke to fill my own prescriptions. My mother depends on me financially since her retirement. Her diabetes medications cost more than my car payment. I skip my own doctor appointments to afford her prescriptions. I diagnosed my own thyroid condition 6 months ago, but still haven't seen a specialist. The copay alone would mean choosing between electricity and healthcare. So I just keep working through the fatigue. My best friend doesn't understand why I won't see a doctor. She's married to another nurse, dual income, no kids. She can't comprehend choosing between groceries and blood work. I fainted at work last week from exhaustion and low blood sugar. My coworkers wanted to run tests, but I refused. I can't afford another medical bill on top of the $42,000 I already owe. My younger sister and I play this sad game where we compare which bills we're paying late this month. We're both healthcare workers who can't afford to be patients in our own system. Dr. Williams noticed I've lost weight and have dark circles. She pulled me aside after rounds and asked if I'm okay. I burst into tears. No one had asked me that in years. I confessed everything to Dr. Williams: the medical debt, the skipped meals, the ignored symptoms. She hugged me and said, "I was you 15 years ago." Her understanding felt like a life raft. Dr. Williams explained that healthcare workers are the worst at self-care. We're so busy saving others, we forget to save ourselves, she said. The truth hit me like a physical blow. She taught me about medical cost navigation, how to negotiate bills, find assistance programs, and maximize insurance. Information that should be basic knowledge but isn't taught in nursing school. My first step was negotiating my medical bills down by 60%. I used scripts Dr. Williams gave me and saved thousands in one afternoon. Why didn't anyone teach us this in nursing school? I started a side business teaching other nurses how to navigate medical costs. My first workshop had 20 attendees, all healthcare workers drowning in medical debt like I was. My consulting business grew faster than I imagined. Hospitals started hiring me to teach their staff financial wellness. I was solving the problem I'd been living for years. I finally saw a specialist about my thyroid condition. Paying cash felt empowering instead of terrifying. For the first time, I could afford to invest in my own health. My mother cried when I told her I paid off all her medical debt. She'd been carrying that guilt for years, thinking her health issues were bankrupting her daughter. I cut back to part-time nursing and focused on my consulting business. The fear was real, but having multiple income streams felt safer than one hospital paycheck. My energy returned as my thyroid treatment worked. I hadn't realized how sick I'd been until I started feeling healthy again. You forget what normal feels like when you're always exhausted. I bought my first investment, a rental property. The tenant's rent pays the mortgage while building my equity. I'm creating wealth instead of just surviving paycheck to paycheck. My best friend now comes to me for financial advice. The dynamic completely flipped. I went from the struggling friend to the successful entrepreneur she admires. I hired my sister to help with my consulting business. We're building together instead of comparing which bills we can't pay. The generational cycle of struggle ends with us. We paid off all $42,000 of medical debt. Watching that final payment process felt more healing than any medication. The weight I'd carried for years finally lifted. I started a scholarship fund for nursing students learning financial literacy. Each student I help feels like healing another piece of my own painful past. The cycle breaks with education. Dr. Williams and I partner on national healthcare finance seminars now. The student has become the colleague. She says I teach with more passion because I live the struggle. I bought my mother a new medication organizer that doesn't stick. Such a small thing, but it represents how far we've come. No more struggling with broken things we can't replace. My consulting business now employs 5 former nurses who were struggling like I was. Each hire feels like pulling someone else out of the healthcare financial trap. I take real lunch breaks now instead of eating expired protein bars from sample closets. The food is fresh and bought with money I earned helping others. The symbolism isn't lost on me. We bought a house with a real garden for my mother. She always wanted to grow her own vegetables, but we never had stable housing long enough. Now she's planting tomatoes with tears of joy. I still work some nursing shifts because I love patient care, not because I need the money. The difference in motivation changes everything about how I show up at the hospital. My medical alert bracelet is now a choice, not a necessity. I wear it proudly as a healthcare advocate instead of hiding it like a symbol of financial failure. I started investing in healthcare stocks. The irony of profiting from the system that almost broke me isn't lost on me. I'm changing it from the inside and outside now. My mother's health improved dramatically once the financial stress lifted. Her blood pressure normalized. Her diabetes became manageable. I hadn't realized money was making us both sick. I wrote a book about healthcare financial navigation. Each copy sold feels like reaching another struggling healthcare worker with the information that saved my life. The nurse who couldn't afford healthcare now has a seven-figure net worth. The transformation still shocks me when I look at my financial statements. Dreams I never dared to have came true. I mentor new nurses now about financial wellness from day one. They'll never have to learn the hard way like I did. The cycle of struggle ends with proper education. My work bag is no longer overstuffed with unpaid bills and collection notices. Now it carries my laptop and business materials. The physical weight change mirrors the emotional one. The healthcare worker who couldn't afford to get sick learned that healing finances is the first step to healing everything else. Money can't buy happiness, but it can buy healthcare and peace. Now when I put on my scrubs, I don't feel trapped by financial desperation. I feel empowered by choice and purpose. The healer has finally healed herself, and now she helps others do the same.